I rise in support of the amendments being proposed to the Firearms Amendment Bill 2017. And essentially to start out from the point that the establishment of penalties for firearm offenses in any jurisdiction is really intended for the most part to act as a deterrent to crimes committed, especially crimes with guns. These penalties are not meant to be onerous or oppressive in terms of the way we live our lives, but rather they are intended to protect and preserve life, to reduce crime, and to enhance public safety, as the honorable mover of the bill would have iterated earlier. For over 20 years now, we have witnessed in the Federation a steady rise in the number of crimes being committed with the use of firearms, all of which run the gamut of manslaughter, murder, attempted murder, robbery, sexual assault, kidnapping, etc. However, as the Minister of State with responsibility for health and social services and community development by extension, it is incumbent on me to support this bill. These ministries, as well as the Ministry of National Security, continue to be heavily impacted by crime and violence, including those crimes involving the use of guns. In my 2017 budget statement made in December 2016, I would have taken the time out to illustrate the heavy toll that crime and gun-related violence would have had on our health and social services infrastructure. I wish to repeat what I would have said then, as the gravity of the impact of crime and violent behavior on our communities, our families, our social systems has indeed not lessened. It has become worse. I said then, and I wish to quote now. Crime continues to place heavy burdens on our health infrastructure. From January to November 2016 alone, the Jeanne France General Hospital had recorded 28 cases of gunshot wounds and 13 of them requiring surgery. Most of the victims of such crimes are young men, several of whom are repeat victims for whom the surgical theater has become a revolving door. In a number of cases, we suffer the misfortune of having to patch up victims of gun violence, only to have them reappear within a short time with similar life-threatening injuries. We must also consider the impact that emergency calls continue to place on our surgeons, the ICU, the EMT workers, accident and emergency, and the surgical theater staff, many of whom would have already invested a full day's work only to be called out again to address these crime-related emergencies. The physical toll on such healthcare workers is therefore relatively high. After such long-haul shifts, the said workers are expected to come out to work the following day to begin the work routine all over again, regardless of whether they are well-rested or sleep-deprived. End of that quote. Of course, Mr. Speaker, the full quantum of the burden on our health system is considerable when one takes into account the operational costs at the hospitals, the use of the ambulance, the A&E department's preoccupation with victims of gun violence at the expense of other, perhaps less critical patients seeking care, medication, hospitalization, lab tests, and the depletion of our precious blood reserves. In a number of these cases, the patients of gun violence are ill-equipped to settle their bills with the hospital, although the cost of their care can often be astronomical. Add to this the general feeling of fear and discomfort among our institution-based health workers who must render care to victims of gun violence, who may still be the target of future assaults, even within the walls of the hospitals. The situation is even worse, Mr. Speaker, when such victims of gun violence are known or suspected criminals themselves. The collateral damage, we should note, from crime and gun-related violence has taken its toll on our social services departments in both St. Kitts and Nevis. We are well aware that crime of any kind results in no winners. Neither the victims nor perpetrators benefit in the long run. The families of perpetrators of gun violence are often equally as vulnerable as the victims and their families. In both cases, intervention is required. This ranges from counseling services, mentorship for young family members, diversion programs to prevent entry into a life of crime, public assistance to meet everyday costs of living, and also life skills training to assist individuals with coping with everyday challenges instead of resorting to antisocial and criminal behavior. It is out of this desire to prevent crime and violence, including gun-related offenses, that our social services departments on both St. Kitts and Nevis would have developed programming such as the Boys Mentorship Program launched last summer for at-risk youth in target communities in St. Kitts, and later to be expanded in Nevis. There is also in existence programs such as MEND and RISE in both St. Kitts and Nevis, which are intended to help our families in crisis live better, more well-adjusted lives, offering them training in parenting, budgeting, home management, and career planning. The continued services of the New Horizon Rehab Center also assist in this regard. The Departments of Social Services on both islands have already begun the development of programming for prisoners in an effort to conduct training so that they will have more options with qualifications through which inmates can secure better livelihoods after their incarceration would have ended. All of these programs, Mr. Speaker, cost money, but they are necessary because our people are worth it. Yet they are viewed by the government as worthwhile investments in terms of reversing our crime statistics and also to prevent future violence. It is evident that the government of St. Kitts and Nevis is doing everything possible to prevent crime and violence in the Federation, including but not limited to the strategies that are meant to mitigate the risk factors. As such, a multi-pronged approach has certainly been employed by the Team Unity administration. Today, as we seek to reenact one such measure, which is the increase in firearm penalties, we are also guided by the 2014 WHO report on the global status of violence prevention. And in that document, the WHO posits that the UN member states must strive to develop a multi-tiered approach to preventing crime wherever possible. These measures include program development, policy formulation, and legislative measures to prevent crime, such as what we are doing here today. Moreover, the WHO extends its comment in that programming must also be in place for the victims of violence, and particularly core responses such as healthcare, social, educational, and legal services for the said victims of violence. In closing, Mr. Speaker, I basically would like to say that today's amendment to the Firearms Bill therefore seeks to put in place a reinforcement of the legislative infrastructure to prevent firearm-related offenses, given that stiffer penalties should naturally result in a reduction in gun offenses, if only for no other reason than planting fear into potential perpetrators of the amount of time that would be spent in incarceration and maybe worse. That being said, Mr. Speaker, I wish this Firearms Amendment Bill safe passage. May it please you.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.